in one of the most remote places on Earth, an outback mining town, hundreds of kilometres from the nearest capital city.
Couldn't imagine being anywhere else.
Broken Hill's emergency department
Saw there.
copes with the extraordinary.
Seen scorpion stings, snake bites, spider bites.
Its patients are those tough enough to call this harsh place home.
I've got a broken leg. I've got horses booked in to come over the next few weeks.
Each day brings the devastating lows.
This was my worst nightmare.
I still well up and, you know, you just kind of swallow it and keep going.
And remarkable highs.
Thank you very much.
The most satisfying part for me is seeing someone get well and go home is wonderful. Thank you, thank you.
That can only come when you live in the middle of nowhere.
I do a lot of supervision here, and probably what gives me the biggest buzz now is seeing these young doctors who come through getting that same buzz that I was getting 5 and 10 years ago.
In other emergency departments, you've got lots of seniors, you've got lots of layers above you, whereas here, you really get a chance to get in, get your hands dirty.
Most people have to think harder and sometimes punch a grade above their weight, so you learn plenty.
The first day I got here, it was cold. I was expecting 35 degrees and I rocked up into town in shorts and a t-shirt and it was 17 degrees and I was freezing. There was this big southerly blowing and I thought, oh, this is a G-up.
Today, 25-year-old Dr. Alex will definitely feel the heat as a Category 1 emergency is unfolding.
Yes.
There's a septic guy coming in, a 72-year-old man with a chest infection.
And what's his numbers? Respiratory rate of 60.
Yeah.
All right, okay.
Minimal air movement with no wheezes at the time.
Yeah.
Rest rate of 60 and tachy 120, 130, BP 130. It's coughing up green and yellow mucus.
James is suffering a chronic lung infection. He is desperately ill and getting worse with every passing minute.
James had a respiratory rate of 60, which is 2 to 3 times the average adult's respiratory rate. Essentially, it's telling us that he's very unwell and he could deteriorate to the point of having a cardiac arrest.
Sir, just give me a nod if you know, give me a squeeze if you know I'm here, all right? Give me a squeeze. Give me a squeeze.
Cases like these really challenge you, especially because I'm only 2 years out of medicine. Sometimes it can be really stressful, but at the same time, I relish the challenge, and that's why I like emergency medicine.
Open your eyes for me, sir. Hello, I'm Alex, I'm your doctor.
I grew up in Tononi, which is near Taree on the mid-north coast of New South Wales. My father was the local paediatrician in town, and I used to go along with him a lot. In fact, I used to prefer to go to hospital than I did at school.
James, do you have any allergies? Only bad women? I don't know if we've got bad women in the hospital, so you're in luck.
It's funny, because when I first started out in medicine, I thought, no way I'd do ED, I want to do ED training, and I've come a full 360, a 180.
How long's this been going on for? About a week or so. Now, are you a smoker? Okay, and right, you've got COPD, do you?
James is a long-time smoker, which has caused significant damage to his lungs, which is limiting his capacity to breathe. He also has evidence of what we call sepsis, or blood poisoning, which requires urgent antibiotics. In addition to that, he's extremely anxious because of the feelings of needing to not get enough air, which we were going to give him some morphine for to take the edge off that.
Dr. Alex's skills are about to be put to the test. As he works to stabilise James, a second trauma patient arrives in ED. 85-year-old Velma hit her head after a fall at home.
Hello, my name's Alex. I'm one of the doctors in the department. I'll be looking after you today. You've had a fall. Okay. Do you know where you are at the moment?
Yes, it's going to the hospital.
Excellent. What day is it?
It's Monday.
It's Monday. I know it's Monday too. Okay, we're going to take this collar away. I don't think you need it. It's very unlikely that you break your neck when you're from a standing height. Before I get into everything, what medical conditions do you have?
Breast cancer.
You've got breast cancer.
And the cancer's gone to the bone.
Okay. And how long have you had the breast cancer for?
2009.
Okay. Have you had any chemotherapy for your breast cancer? Okay. Are you going to consider you don't want any chemo for it? Okay. So it's about just managing your pain. All right. Are you able to lean forward? Can you sit forward if I help you sit forward? All right. Let's have a look at this scalp laceration. Oh, darling. You've done a good job of it. She's hit the back of her head and she's got what we call red flags for a traumatic brain bleed, including she's got nausea, she's got a thumping headache, she's feeling quite dizzy at the moment, and she's a little bit drowsy, so she definitely warrants a CT scan of the brain.
The challenge of managing 2 patients within this scenario was quite confronting. Working in broken hill emergency can be quite stressful at times due to limited resources and less staff in a remote location. So when a patient does deteriorate, it can be quite nerve-wracking, already adding to the stress of a critically ill patient.
2 lives hang in the balance. The pressure on Alex is starting to show.
Got a few minutes? No, I don't. Yeah, you have to wait, sorry. Just got 2 sick patients.
Tony was riding his motorbike 11 days ago, about 80 k's an hour on a dirt track, and he came off, hit his head.
This way. We're going to go to that room around here. We're going to so I can turn the lights out. I need you to come with me.
Broken Hill local Tony suffered relatively minor injuries in the crash.
You okay?
But in the days since, he's developed a severe headache. And it's getting worse.
He's had a headache for about 4 days and he hasn't quite been right since the accident. He was wearing a helmet, which was very good, and full leathers and padding and Kevlar jeans, and only got a broken rib and concussion.
Hi, Tony. How's it going, my friend? So my name's Dr. Golding. Tell me what's been happening then, my friend. What's brought you in today?
I just started getting a very bad headache on Monday afternoon, then Tuesday I started feeling a bit dizzy and it's turned into a migraine.
All right, so where's the pain in your head, Tony?
It's just all over.
All over the whole head. Anywhere is it worse? No. I noticed you're in a motorbike accident. Tell me what happened.
I was just out riding a motorbike with a mate and just came off.
How fast were you going when you came off?
About 80k, 90k an hour.
Really? Okay. When you came off, do you remember where you hit and how you landed?
I don't really remember how I landed, but I think I hit my head first.
Did you crack your helmet?
Yeah.
The helmet was cracked?
Yeah.
Helmet's a write-off.
Okay, because we did a CT scan of your brain at that time, and it was normal, but obviously you've developed a significant headache since then. But I think it's going to be probably worth putting you through the scanner again, just to make sure you haven't got a small bleed there that's causing your headache.
Tony's CT scan came up normal last time, so they weren't too worried. No bleeding on the brain or swelling, so... My biggest worry is that something's changed in his brain, and that's why he's getting a massive headache and migraines. I'm just really worried.
He's just a bit confused. He's confused with himself. He doesn't know what's going on, poor little bugger. It's all right, in hospital.
Patrick is just 14. His parents brought him into emergency after he had a sudden, violent seizure at home.
He just went very quiet and then seemed to come very absent. And then the legs started shaking and then it went through the whole body. And then we just laid him down in like the coma position because he was having trouble breathing with it too.
Patrick has spent his whole life in and out of hospital. His long list of medical problems include vision and hearing difficulties and severe autism. On top of everything, he can't speak.
He's been having seizures since the beginning of the year. We're currently under investigation to what might be triggering them. So we've done a few tests and they haven't found anything conclusive.
We can't talk to him, we can't communicate with him, and we can't tell him everything. All we can do is reassure him and try to give him as much love or care. Yeah, not much.
When he gets seizure, did you ever come to the hospital with this presentation before? Does he need Keppra straight away, or they can give midazolam or something like that?
He's a gem of a kid. Just a little loner. Just does everything himself. Doesn't complain. Has a pretty rough life, really. I think if we was in Adelaide, they would put him straight into big tests, like when it happens. But here, because there's such distance, they got to weigh up, is it worth it or isn't worth it? His last big seizure, I wanted him sent away straight away, and they refused me that right, or that benefit, that option, whatever.
I can understand where Patrick's parents are coming from. They want the best for their child. Sometimes people expect a lot more than what we can reasonably deliver as a small rural hospital, and we just have to do the best we can in explaining what's reasonable treatment for them and their loved ones.
So the plan will be the same which we did, blood test, right? We'll see how it goes. He will go to the ward, they will see him later on, probably tomorrow. They will see in between any seizures, I will write it down. They need to call the doctor immediately and they will give the medications to him, right? Yep.
And I fear one day that we may not have a problem. It might fit, and that's the end. Might be a panic merchant, don't know. They'll look after him here, they'll watch him for a couple of days, monitor him, nothing will happen. He will be released and he'll probably have his medication shifted, changed, or maybe a new medication or something. We'll trial that till the next seizure. That's how it's been. That's how I think it's going to go. And it's not an ideal outcome. It's the best outcome that we can get from Broken Hill, I suppose.
A lot of overseas doctors who come to Australia often find it difficult to get their foot into the Australian healthcare system. Places like Broken Hill offer them a chance to do that in an appropriately supervised way.
Just wanted to run by this 34-year-old guy with you, if that's okay. Yeah. Came in about 2 weeks ago after a motorbike accident. Fell off apparently about 80, 90K. Just looking at him and with the history, I was just wondering whether he'd be suitable for a CT. I think he probably would be, but I'm just worried about the radiation in such a young guy, basically.
Yeah, it's absolutely appropriate to think about stuff like radiation, particularly in young guys. But I think with a story like that, you can't not do a CT in this guy. It's him lying down in the room next door, is it?
Yeah, that's him.
Yeah, no, he looks pretty average. I think I'd get a CT for sure, repeat the CT.
With Tony now, what I'm really worried about is that he's got a slow bleed on his brain. The type of bleed that we worry that he had would be a subdural bleed, which is basically around the edges and squashes the brain in basically from the outside. If he has a bleed on the brain, it's really a potentially life-threatening situation.
Tony has suffered migraine headaches in the past, but none as powerful and persistent as this.
Tony gets them occasionally. Or I've known him for over 12 months anyway, and he hasn't had one.
So it's good news really today, Tony. We've done that repeat scan and it's all normal. So there's no bleed there. Did your blood test as well. Shows that you may have a little bit of an infection going on somewhere, but other than that, it was all normal. So it might be the start of a bit of a flu or something for you, but I think all this headache and everything is just down to your usual migraines that are obviously a lot worse now and are really debilitating you.
Yeah, pretty relieved. Just wanted to make sure there was nothing going on with my brain, I suppose, any bleeding, so that's the most important thing.
Oh, I'm very relieved. Very relieved, actually.
For Tony, it's good news. But for Velma, the results of her head scan confirm the worst.
No worries, thank you. Bye-bye. So she's had a bleed.
Yeah.
Miss Pearce has evidence of a bleed in her brain, which is what we were looking for and what I was concerned about with those red flags. So I'm waiting for the formal report to come through from the radiologist, but it looks like you've had a little bleed on the brain.
Oh, that's what's caused it.
If you were to become unwell, like very unwell, and require brain surgery, it's probably not appropriate that we go down that path with the breast cancer, okay? Because of this bleed, sometimes they do get bigger and need surgery. But in your case, I think we just make you comfortable.
I think so too.
Okay? You don't look like a woman who's got breast cancer, that's for sure.
Oh, thank you.
You don't look 85 either. Do you want some more superlatives? Or? You meet people on occasion, so you just know you're going to get along with straight away. And Velma was one of those people. She's an absolute sweetheart, but she was also incredibly stoic and upfront about her expectations with her cancer, especially when she has such limited time left.
Things look brighter for Alex's other patient. James seems to have turned a corner.
That's helped your breathing a lot, hasn't it, James? That's good. Oh, beautiful. That's what we like to do. James responded really well to the puffers, which helped open up his airways, which means that we didn't need to use further interventions to help his breathing at that stage. And so he's well enough to go to the ward.
Originally, I was born in Canada, worked in a sawmill, worked as a lifeguard, and then in a paper factory, and then moved over here, and then decided to do medicine. Yeah.
Dr. Craig Kennedy has only been in town for a month, and he's about to meet one of Broken Hill Hospital's so-called frequent flyers. Stanley has a history of heart problems and has been suffering more chest pains.
Hey, Stanley.
Not too bad.
How you going? My name's Craig. I'm one of the senior doctors on today.
How you do, Craig?
How you going?
Oh, all right now.
Tell me about this pain. Where was it? How strong was it?
Right there, and it's very strong. Somebody gripping your chest.
Okay. Does this feel like your normal angina?
Yeah.
Yeah. Okay.
They don't tell me.
All right. I'm just going to have a quick feel of the pulses in your sock. You've got odd socks on.
Oh, I don't know. I thought they were both Thursdays.
No, this is Sunday.
Is it? Oh, another one's Thursday.
Yeah, the right one's Thursday. It's Saturday, so you're...
It's Saturday, yeah, I know.
Your left foot's too early and your right foot's too slow.
It's too slow.
So you're pretty in touch with the cardiologist. Frequent flyer.
Frequent flyer.
Do you get points?
No. Yeah, I'm quite used to being up here, but I've made it second home. I've been in all the wards, except the pregnancy ward, I haven't been in there. And I'm on, 10, 20, 24 pills today. My wife's name is Betty. I met her I used to be Martin's Corner. I met her with her boyfriend one night, and the next night I was walking past, and she was there, but he wasn't. We married 58 years, nearly 59 the next month. We got on well together. She liked dancing. We liked going to the pictures.
Deep breath.
She's got Alzheimer's disease. She is out at St Anne's. Yes, 7 years she's been out there now. And I have missed her, I'll tell you that. But there's not much I can do about it. I go and try and talk to her, but I can't understand a word she's saying. It's a terrible disease. I can go in, her face lightens up and she beckons me across. And I say, "What's my name?" "Oh, I don't know." I feel terrible, to tell you the fact. I believe in euthanasia. Have they got any results back yet?
Yeah, so the two blood tests that we did to check your heart have both come back negative, so that's good.
That's good.
That's good. We're just still waiting on some results.
Just old age creeping on.
How do we avoid that, Stan?
I would not have a clue.
Me either.
Dr. Alex has been under the pump all day, and that learning curve is about to get even steeper.
That one there, that a ram bashed it against the fence a few weeks ago and a nail, all that's fallen off, still a bit swollen, but it's not too bad now. This one here a few years ago, a loading ramp fell on top of it and took it off. The nail grew out the end of it after they stitched it all back up. And this one here's been bent anyway before, so it's probably got a good one this time.
Station owner Richard has another hand injury to add to the list. Today, he gashed a finger while fixing a windmill and has driven more than 200 kilometres to Broken Hill Hospital.
Yeah, it's cut the fingernail clean in half and about halfway underneath. It's taken almost the tip clean off it.
Can you feel the tip of your finger?
Yeah.
It's not in the worst spot. Is that your dominant hand?
Yeah.
You're a right-hander. The fact that it's the tip of your finger, even though it's on your dominant hand, if this middle section and the base segment's fine, generally we don't do too much with them. You've got good blood supply. Look, what I'll do, I'm going to do a thing called a ring block, which is where I'm going to put a needle this side and essentially numb your whole finger.
Yep.
And I'll give it a good clean and then we'll have a look at it.
Yeah.
Okay? You're not going to be a hand model anytime soon, that's for sure. Look, if the farm doesn't work out, a career in hand modelling is just not going to work out for you, I can tell. It's not in a particularly bad spot. It is on his dominant hand, which is something you always worry about. But when you've got injuries right at the tips of the fingers or the end of the phalanges, there's usually not that much you can do about them anyway. You just need to make sure that the nail is still in its bed and doesn't need to come off, and he just gets a good clean up. And he should be right to go back to work in the next few days. What do you have sheep on the station or cattle?
Both. We're just shearing at the minute.
You right?
Yeah.
No.
Oh, nasty.
I think that is actually down to the bone. What's actually happened when I've just started to have a look and a bit of a clean, around the back there was actually just held on by dried blood, was just sticking the finger down. And so as I've washed it off, the blood's gone away and you can see the extent of the injury, and it's well and truly down into his bone. The only thing that's holding the tip of his finger on is a little bit of soft tissue here. I've never done a full finger come across like that before. This is people's livelihood, so the last thing I want for him is to get an infection in his bone. Hand surgery is a highly specialised area of surgery, and for a junior doctor in the middle of nowhere, it's a bit above my pay grade.
Are you doing all right so far?
Today's the first. This is the first time I've ever put a stitch through a nail bed, mate. Informing patients and being transparent actually gives you more confidence, because then you're not trying to hide anything. In this case, saying, yeah, look, I haven't put a finger back on, and telling him that, I think that's the most appropriate thing. In his case, having a crack is the Broken Hill way. He just wanted to get out of the department, and he was happy for me to have a go. This is making me woozy. I've just put a stitch through your fingernail.
Holy dooly. Whew. I can do gore, I can do anything, I can do lots of blood, but that one, that's the first time I've ever done something I've just gone, oh, oy vey. Oh, I'm glad you don't have to watch this right now.
Full faith in your doc, you'll be right.
Oh, that's a corker of a feel. There we go, that's a good one. There's only a couple of things in medicine that have shaken me in the last 2 years, and that was one of them. When I was putting the stitch through the nail bed, I certainly started to feel a bit squeamish. made me check myself for a second. I didn't expect that to happen, but I think anyone seeing that could have a bit of empathy with the patient. Fortunately, he didn't feel anything. It was good.
Pretty flash, all right.
Next time on Outback ER, doctors take drastic action after a dangerous rooftop plunge.
Unless that pressure is relieved, then the legs will die.
A late-night feast goes up in flames.
The smoke alarm's going off, and there was a big, huge flame of smoke. Jeez. I didn't know what to do.
And an unusual rescue mission.
And the fire brigade actually cut the wall of her house.
For a Broken Hill local.
There's everything you want in Broken Hill.